Hi, everybody. This is Jonathan Bass. I do content marketing over at Revenue Well, and thanks for being here today for our Practice Perfect webinar. Um, I'm super excited to have Debra Engelhardt-Nash with us. Today's webinar is going to cover how to inspire patients, how to really connect with them on a deeper level, which, is arguably the most important part of your day-to-day. Debra, she's the co-founder of the Nash Institute. She's the president of ADMC. She's on the ADA advisory board. I mean, I could go on with a list of accomplishments here. She won the Gordon Christensen Award for outstanding lecturing, which, by the way, she was the first non-dentist ever to do so. So it's my great pleasure to hand this over to Debra. If you have any questions during our webinar, please submit them. We'll have a Q&A at the end, and I'll be moderating that. So without further ado, Debra, the floor is yours.
Well, thank you so much, and welcome everyone. Some of you are probably on your lunch hour and you're wolfing down your sandwiches and are grabbing something out of the refrigerator. So thank you so much for giving me your time. What a rare commodity time is, and the fact that you are giving this time for your development and your growth already typifies your passion and your commitment to be more effective in your workplace. I'm actually on my lunch hour too. So in addition to consulting and speaking, I work in a dental office every day. I know that sometimes when you listen to a speaker or you listen to a webinar podcast, you say, well, they don't really answer the phone. They don't really have to deal with the same kind of calls I deal with. They don't, have to get that grumpy patient or that patient who asks if our consults are free or how much do you charge for. But I do get to do all those things. I love the telephone. I love patient interaction. It's probably why I have stayed in dentistry over 30 years. It's working with the patients and working with spectacular teams. So I think that that's what's really critical to me is that I know that my behavior every day when I come to work, my behavior impacts the people with whom I touch, whether it be my teammates, whether it be my patients or my doctor who depends on me. I'm going to either improve their world or I'm going to worsen it, and I can choose. I can choose which way it's going to go. I'm going to accomplish one thing or another. So I know that when I can help a patient understand and appreciate the quality of care that we provide and why our fee is worthy, then I know I've done a good job. So if we could actually quantify, if you will, this is not a statistic day, talk about numbers, but you can actually quantify your customer service skills. You can determine whether or not you are treating your patients well, because if you are, they will keep coming back. And if you're treating your patients well, they will refer their friends. And if you're treating your patients well, they will pay their bill. And if you're treating your patients well, they will accept your treatment plan. So all of those quantifiers or indicators in your practice will actually tell you whether or not you are improving the world of your patients or you are worsening the world of your patients. One of the things to remember, your patients call your office because they want you to take them to a better place. They've already chosen you the minute they picked up the telephone. Think about this. I made a decision, typically, probably in today's world, through social media. I mean, Google has such a huge influence and a huge impact on our practices. I'm sure most of you who are listening are very adept at social media. You understand the impact of social media, how critical it is for your practice. I mean, I guess Google starts with a capital G, so does God. So maybe Google is the God of social media for us these days. So however they come to you, they've already chosen your office. So now my responsibility is to validate that they made the right decision. So that's what I do. And there's so many ways we can make that happen, because the first interaction is typically the telephone. So when we talk about how do we help the patient understand that they made the right decision, we take 2 phone calls. let's suggest that I call your office and I say, hi, my name is Debra Nash, and I'd like to make an appointment for a new patient examination. Well, sometimes one office could answer the phone such as this. Well, Deborah, let me tell you about all new patients. Let me tell you what we do. All new patients get a comprehensive examination. They get a full mouth series of radiographs. They get periodontal probings. They get a full written treatment plan. We will actually verify your insurance benefits. What I'm getting to is we actually start offering the patients a menu of services that we're going to offer. That isn't what's really, at this point, that isn't what's really important to the patient. We'll even talk about the telephone shopper in just a moment. Let's take another office who might answer it this way. Hi, my name is Debra Nash, and I'm calling to make an appointment for a new patient examination. Deborah, let me be the first to welcome you to our practice. So that I make sure that we schedule you appropriately and that we meet your expectations, may I ask you a few questions? Always get permission before you start asking questions. So many times we launch into, the minute I give you my name, offices may say, well, what type of dental insurance do you have? And are you in pain? Or, and you haven't really connected with me yet. So when we talk about the telephone, we talk about that is the portal to your practice. Typically, even if I'm going to schedule online, if I have an opportunity as a patient in your practice to request an appointment online and schedule an appointment, there will be a follow-up telephone call. That is going to make or break how this relationship with the patient is going to start. So that's pretty critical. Think about this, how patients come to your practice. So an awareness has been created. They learn about you somehow. They create a phone call. They make a phone call, and then they enter your reception rooms. So what you might be sitting in your reception room right now, you might be sitting in your team lounge right now. But I want you to think about, what does your reception room say about you? Your reception room should be an attraction to your practice, not a distraction away from your practice. And by that I mean televisions and outside media, such as if you're playing cable television, you're playing the Ellen DeGeneres show, you're playing Oprah, you're playing, heaven forbid, Fox News or CNN or America Online News. Those are distractions. Those are distractions away from dentistry. And we want to use the reception room as an attraction to dentistry. So think about, what does my reception room say about us? Is there information in the reception room about our practice? Are there visual learning opportunities for the patient while they're sitting in the reception room? So think about how the patients are coming in. I mean, we may go back to the phone call. We can even talk about how we follow up from the initial appointment to the patient actually coming in, and what kind of interaction do we have with the patient between making the appointment and coming into the office, and how do we secure that the patient will actually arrive? How do we secure confirmed appointments and kept appointments? We'll talk about that in just a moment. What sort of office literature are you sending to the patients? What are you sending out, or what are you sending out on social media? I mean, here I am, I'm working with Revenue Well today on this webinar, and oh my gosh, what great opportunities Revenue Well has for you to send. Actually, we can call it office literature, but for you to send a welcoming video from your practice, from your doctor or your treatment coordinator or your entire team. I mean, you can be creative. They will help you. Wouldn't that be great that once I make the appointment as a patient, I get a video from your practice welcoming me to your office? I mean, talk about creating a connection even before I walked in. That would be amazing. It would be a live welcome letter, a live welcome packet. If you're not doing that, then what sort of office literature are you sending? Are you sending it via email? Are you sending it via social media? Are you putting it in snail mail and our standard post? What is it saying about your practice? I want you to think about your literature not as the rules and regulations of your office. You're not actually sending them your office policies. That's not a friendly word. it's not appropriate at this time to be discussing your office policies with your patients. This is the friendly talk. This is what to expect, how they're going to feel while they're in your care, how well you're going to take care of them, who you are and what you're about, what's exceptional about you. The policy statements, the rules statements can come later. I have a favorite saying. Actually, Jonathan and I were talking earlier about sayings and quotes. I have a favorite saying about when to talk to patients about the rules and regulations of being a part of your practice. The saying goes something like this. If you like a person, they could drop a plate of food on your lap and you wouldn't mind. But if you don't like a person, the way they hold their fork will drive you insane. Some of you might be chuckling right now because you're thinking about people already on both sides who could drop a plate of food on your lap, and people who hold their fork funny and you already know it because you've watched them. That saying to me reflects why we don't send office policy statements to our patients until we have established a relationship. I will be more compliant to your office protocols. I will be more compliant to your office policies once I know you and like you and know that it's worth it, know that you have my best interest at heart, that I'm going to be well taken care of, that I'm in an exceptional environment. So when you tell me that I have to come in on the third Tuesday of the month when the moon is in the 7th house and Earth aligns with Mars, and I have to bring oatmeal, raisin cookies to the doctor on that day, if I like you, sure, I'll be happy to do that. If I'm not sure yet, those might not be policies or rules that I want to follow. So take a look at your office literature and ask yourself if that works for you. When they come into your practice, who do they meet first? They meet the team. I mean, typically, the last person that the patient meets on the dental team is the doctor. I think that's so. The team is actually setting the tone for the patient's experience. Experts will tell you that patients have made the decision to accept your practice, first of all, before they call. Second of all, the moment they come into the office. And third of all, the other option is within the first 10 minutes. Well, in most offices, ladies and gentlemen, within the first 10 minutes of coming into your practice, whom haven't they met yet? They haven't met the doctor. So it's the team setting the tone. Question, team members, what are you saying about the doctor? What are you telling the patients about the doctor? We're going to get to that. How are you introducing the doctor to the patient so the patient is excited, they're anticipating? Sort of like when you're going to introduce your best friend to another friend, you say, wait till you meet her, or wait till you meet him. You are going to love her. This is why she's so fun, or she's this. So we'll talk more about how specifically should we introduce the doctor to a patient when we're talking about your patient care and about the exceptional dentistry that your practice provides. What makes you unique? What makes you special? So they meet the team, and then they come in for the consultation, the examination. This is the time when they meet the doctor. I will also suggest this. I'm going to have a lot of tips in this next 45 minutes that we have together. The doctor should never meet a new patient by himself or herself. There should always be someone in the room, not necessarily for safety reasons or privacy reasons, but there should always be an introduction to the doctor. So the doctor should not be alone. There should be someone who's acting as liaison, who's acting as the ambassador, the one who's done the introduction. And so when the doctor walks into the room, the treatment coordinator or the hygienist or the dental assistant will say, Doctor, I have the pleasure of introducing Debra Nash to you today. Debra and I have been talking a little bit about her dental history and what inspired her to be here today. Debra, let me share that with Doctor so she can be on the same page with us. So that type of introduction, so the patient feels comfortable. The patient has an opportunity to take a look at the doctor. I will also, this is a tip. The patient should never meet the doctor in a supine position. lying down. That puts the patient in a feeling of vulnerability. There's no eye contact that's being delivered. It disrupts, or it creates an obstacle for the connection, for the physical connection, for the eye contact connection. It's a disruption. It's an interruption. It's an obstacle to that. It blocks it. So the patient should always be sitting up when they meet the doctor for the first time. Then the doctor does a treatment examination and presents a diagnosis. Then we have treatment acceptance, and then financial arrangements are made. And then we go into treatment. Now, I'll also say this, when we talk about treatment acceptance, I've got so much to tell you in this little brief time we have. Each one of these could be an hour webinar in themselves. Here's something that may be different for many of you who are listening. The decision to accept treatment happens with the clinical team, not the financial team. Let me say that again. The decision to accept treatment happens with the clinical team, not the financial team. The financial team has the responsibility of negotiating the terms of payment, but it's actually the clinical team that has the responsibility of getting the patient to say yes. So that's important. Here's some suggestions when your patient is making the phone call, when you're telling them about your practice, rather than spouting out all of your policies or telling them what's going to be happening on the day of the visit and how it's going to be paid for and how insurance will be provided. I mean, let's think about this for a moment, ladies and gentlemen. Some of us are concerned or perplexed, maybe verklempt a little bit about the insurance dependence that some of your patients may have. Why have our patients become so dependent on insurance coverage? And we'll talk about that. I will ask you, in your practice, who is the first one who brings up insurance? Is it you or is it them? So many times when I'm consulting in an office and I'm listening to the telephone call, the call goes something like this. Hi, my name is Debra Nash. I'd like to make an appointment for a new patient examination. And the first question is, what insurance do you have? And so then I say, well, I have MetLife. Oh, MetLife. Well, let me tell you how we handle MetLife. Here's your plan. You have MetLife 200. Here's your copay. Here's your deductible. Here's what they'll cover. Here's how we handle that. And we go into a 10-minute conversation about insurance. And now, why wouldn't the patient think that the insurance is most important? We brought it up first. We've spent 10 minutes talking about it. We haven't talked about what features we have in our practice. We haven't talked about how the patient's going to love us, the qualities and the attributes of the doctor. So, of course, the insurance now becomes the dominant factor. So think about these questions a little bit. I love this question. What inspired you to seek our care? Find out why they called. That will help you direct your conversation so appropriately. And I really like that word. There was a reason why I chose to call your office today. What was it? Let's find that out. And then always get permission. May I tell you a little bit more about our practice? And let me, our doctor, let me tell you about our doctor, whether it be our doctor has exceptional education, our doctor is committed to offering the patients state-of-the-art care, our doctor is a great listener, our doctor has great communication skills. Get me excited about meeting the big kahuna or the big kahuna S. Talk about your office philosophy of care. Team members, I hope you know what that is. And once again, if you're a RevenueWell client, ask RevenueWell to help you record a video about your philosophy of care. How great to have the doctor sit and record that. So now when a new patient is getting ready to come in for their first visit, they get a video from you talking about your office and talking about the quality of care that you provide. They get to see the doctor's face. They get to learn a little bit more about the doctor. So think about that. You might want to reach out to RevenueWell to do that for you. So that's important. I am not advancing. I don't know why. So, Jonathan, I don't know if you can take over, but I am locked. I'll just keep talking, and maybe we'll have Jonathan who can jump in here with his technology and make it happen.
Yeah, I will. I'll pull up my screen here.
Yeah, so we're this is one of those, little funky glitches. I would as we're switching over to him taking control of the screen. When was the last time you had a team meeting that you actually sat down and said, what you all say about the practice and why you're there? 80% of the reason why patients choose your office is not your clinical ability. They do not know that the tertiary anatomy of your crowns are any better than, and they don't even know what tertiary anatomy is. So my computer is acting up on me. So it's going to ask me to quit. You probably are all seeing this, and this is really fun. So the 80% of the reason why patients choose your care is based on the relationships they develop with you. It has nothing to do with the tertiary anatomy of your work. So I think that that's important. Is how are you establishing relationship? How quickly can you do this? I don't even have here I go. Look what he's done here.
Yep, let me see. So give me 1 second here.
Yeah. Hi,
All
everybody.
right.
Take another bite of your, let me see. Oh, now I'm back. I don't know what happened. So let me go back and where we are. So we're, ta-da, ta-da. Hello, everybody.
Do you have your screen?
I'm back up.
Okay, then I will switch
so,
back over to you. I'm
all
sorry,
right.
people.
Sorry, everybody.
Yep, just some bouncing around here.
Yeah. So every team is responsible for reinforcing a clear and consistent practice message. What is your message? That's important. How do you differentiate yourself in your practice? Here's the questions that you should be asking yourselves, that you can differentiate your practice to your patients. How do you provide the highest level of service when others are competing? And you're going to have to practice. I mean, excellent service skills take practice. Do you know that actually we all know who Starbucks is? I don't know, no matter where you live in this world, I was going to say country, but wherever you live in this world, you know Starbucks. Do you know that Starbucks spends more money on training their people than on actual marketing? I mean, you might ask yourself, well, they don't have to market anymore. They're on every corner. Yeah, they spend so much on training because they actually know that the people who are representing Starbucks are the people who are making your coffee, the people who are handing it to you over the counter. And actually, the same thing with, if you think about Disneyland and Disney World, if you've had the opportunity to visit either one of those theme parks, think about the street sweepers at Disneyland or Disney World. You think, oh my gosh, how important is the person who's sweeping the streets at Disneyland? Well, you know what? They actually spend 4 weeks in training a street sweeper at Disneyland because they know that if you are a guest at the park and you need directions or you want some advice or you need to find out where the nearest restroom is, you need to find out where the nearest restroom is, the restaurant, or where the ride is, where's Space Mountain, you're going to go to probably the person sweeping the street there with their broom. And so they make sure that they are well trained. So how do you check every day that you are committed to service excellence in your practice? And that's important. So here are a couple service cues for you. First of all, make a memorable first impression. How do you do that? That might be something that you would talk about in a team meeting. I've got so much to tell you in such a short period of time, but making a memorable first impression. How do I do that? Well, how do you make a memorable first impression? You look a person in the eye. You shake their hand. You stand to greet them. So think about this. You're sitting at the front desk, and a patient approaches your front desk. A new patient, any patient. Patient approaches your front desk, and you sit there and you look up. And sometimes you look down at the computer screen. How about standing up and putting your hand out and saying, "Hi, my name is Debra. It's a pleasure to meet you. I'm the one who spoke with you on the phone." Wow, there's again more connection. Speak a service language, wear a service wardrobe. That means when I come to work, my appearance demonstrates that it matters, that my appearance matters. Now, you can say, does it really matter what I wear to work? Absolutely matters. I'm a big fan of team uniforms. I think it's critical that we look like we work together, that I'm part of the team. uniforms that are well pressed, that are well made, by the way, not those little paper things, not those paper uniforms with the little icky snaps on them, but really nice uniforms. You're asking your patient to make a significant investment in their dental care, and you can't go out and buy a decent uniform. Please wear something that typifies, that demonstrates the quality of care that you provide. And the paper uniforms, surgically, I understand. But paper uniforms in any other environment, not a big fan of that. Speaking a service language, the word policy is not a service word. The word policy is a rules word, a regulations word. I'm just calling. The word just minimizes everything. So what's your service language? How can I help? Here's two really quick things that I would tell you, two phrases that work so well, not only for your patients, they also work with your family and your friends. Help me understand is a great way to start a conversation with somebody. Or with a patient, I have a problem and I need your help. So for example, let's say you have a patient who is a chronic no-shower, who's chronically late. So rather than saying, Debra, we're going to have to initiate a broken appointment fee, or we're going to have to start charging you, or we're no longer going to appoint you because you're so flaky, I'm going to say, Debra, I have a problem and I need your help. We continue to make appointments for you that you fail to keep. And then be quiet and hear what they have to say. Let them talk. That's service. Being a great listener is providing great customer service. Let me say that again. Being a great listener is providing great customer service. And if you were watching me talk about even where do you sit, how do you stand, looking at a computer screen and trying to have a conversation with a patient is like you trying to have a conversation with a person while they're on their cell phone. How does it make you feel? How does it make you feel when you're trying to have a conversation and someone's looking at their telephone screen as opposed to looking at you? Think about your patient. So rather than looking at a computer screen, I'm actually looking at them. Hospitality first, communicate the heart and the soul of the organization. In order to do that, ladies and gentlemen, you need to know what is the heart and the soul of your organization. Why do you do what you do? Why does your doctor do what you do? Doctor, if you haven't spent any time talking to the team about that, then I think it's important to sit down with them and say, this is why I do what I do. So now when the team members say, this is why the doctor does what she does. Listen to understand. I just talked about listening and what a critical quality that is for your practice. Create the perception of quality. Fun thing to do for a team meeting is go buy one of those giant Post-it notes. Sit down, draw a line down the middle, make a list on one of those giant Post-it notes I'm talking about. They're 3 feet wide by 5 feet long, or 3 feet by 3 feet. Stick it up on the wall and say, what do we have in our practice that creates the perception of quality to our patients? And what are the obstacles that is a misperception of our quality? I mean, for example, is it worn carpet? Is it old paint? Is it a messy front desk? Is it clutter? Is it running late? Figure out what are the obstacles and how can we eliminate them, because these are misperceptions of our quality. Match what the patient wants with what you can do. How do you do that? How do you match the patient wants for the blah, 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 blah? You're thinking, what happened to her sound? Match what the patient wants with what you can do. You are going to have to find out what the patient wants. So who should talk first? The patient. The patient should tell you what they want. Tell you about their expectations. Tell you what they're seeking, so you can say, oh my gosh, I'm glad you chose us, because this sounds like we're a perfect match for you. You can't say that unless you have had a conversation with them. Endorse the doctor. I mentioned that when we were having a little bit of a glitch, being, again, what do you say about the doctor? Now, team members, you say, do I really have to do my spiel about the doctor? Let me give you a thought to inspire you. Should I endorse my doctor? Should I endorse the man or the woman who feeds my family, who puts bread on my table, who probably cares most about payroll and about any other expense in the practice? Should I endorse that person? I absolutely. Does that person deserve my respect? Absolutely. So pay attention to that. Describe how your office systems will enhance results. We'll talk a little bit more about that. We'll talk about the other things as we get through. What kind of first impression are you making? I mean, you size people up. between 30 seconds and 2 minutes. I gave you some cues on how to meet people for the first time. Dental assistants and hygienists. When you are meeting your patient for the first time, do you stand at a door and call them to you, or do you go out to them? Do you go out to them and say, "Hi, Mrs. Smegley, my name is Deborah. I'll be working with you during your care today. May I escort you to the treatment area?" As opposed to, "Hey, Mrs. Smegley, we're ready for you," or "Mrs. Smegley, are you ready?" And so think about what kind of first impression you are creating. How are we creating an awareness? Well, social media is really external marketing. It's actually the great thing about social media. It's external marketing that brings it internal. I know that sounds weird, but you should be spending some dollars on how you're marketing your practice. Social media hasn't eliminated spending marketing. It's changed the rules of it. We're no longer spending money on a yellow page advertisement. We're spending money on social media engagement. I really defer to experts on that. I love outsourcing social media. I love outsourcing website development and utilization, maximizing exposure to the people who know how to do it. I'm going to be spending some money to do that. And what should I be expecting? If I'm going to be spending 3 to 7% of last year's gross production on marketing, what should I expect in return? Well, for me, we call that return on investment. What should my ROI be? What should my return on investment be? And I like to make that a 5-to-1 ratio. So I want to say I want to receive 5 times back what I invested. So if I'm going to spend $1,500 on a full page ad in a magazine, I want to get 5 times that in treatment from a patient who saw that ad. That's important. How are you innovating your practice? How are you innovating your patient communication system? Again, I'm going to go back to this quote by Ian Schaefer. Consumers are transforming faster than we are, and we've got to make sure that we are keeping pace. We're in trouble if we don't have a YouTube account and a Facebook account, and that we don't have Google reviews. There are so many other components. Instagram, oh my gosh, Instagram is going nuts. And then there's Angie's List, and there's Judy's book. And again, how do you innovate reaching out to your patient? If you're a Revenue Well client, they can help you do that. Innovation's got to be part of your culture and your practice. It's out there, it's out in the world, and we have to let our patients know that we are current with technology. We are current with the trends. Our practice is we're on the leading edge always. So external marketing is important, and once you bring them in, then let's take a look at internal marketing. If it's the lifeblood of any practice, customer service is not a department, is not the responsibility of one person. It's an entire attitude of the patient. I mean, I am buying your customer service. My insurance is paying for the crown, but the customers, but what I'm paying for, I'm paying the portion, the elective portion, based on your customer service. So let's do a quick verbal skill here. So when patients say, "Well, how much do you charge for? How much do you charge for a crown?" So I'd be happy to discuss our fees with you. Once again, I'll tell you that if a patient starts asking you about fees, avoid answering by saying, "I'm sorry, you don't quote fees over the telephone." Or you say something like, "Before we can quote you any fees, you need to come in for a comprehensive examination and radiographs and total oral cancer screening." And say, "You know what? I would be happy to discuss our fees with you. Before I do, may I ask you a few questions? What inspired you to call our office?" And then I'm going to say, "May I tell you a little bit more about us?" And we'll talk about our customer service. And I'll say something like this. When I describe the qualities that our office has, I'll say, if you're choosing your patient based on the lowest fee possible, we may not be the practice that you choose. But if you're choosing your practice based on the way you're going to be treated while in their care, quality and the professionalism of the team, the expertise of the doctor, the careful attention to the treatment that we provide, if those are important to you, then we will be the office that you want. Because whether you paid $400 or $4,000, if you're not happy, you paid too much. And that's our philosophy. For us, it's about patient care. It's about serving you well. That is not necessarily reflected on an insurance form. So we will do our very best to help you receive whatever dental allowance you have coming, but we will not compromise our standards based on the limitations, exceptions, or exclusions of any plan. Now notice a couple of words I said. I said we will help you receive whatever dental allowance you have coming. I don't say benefit. We'll help you receive whatever dental allowance you have coming. Our fee, and we will not compromise our standards based on fees. We will not reduce our standards based on the limitations, exclusions, or exceptions of any plan. Here's what I also suggest when patients are starting to ask about fees. Our fees are based on three things: the skill required to do it well, the time it takes to do it right, and the materials that we use so that your restorations will endure, that your treatment will last a long time. Those are the three criteria for fees. And so those are internal marketing languaging that we can provide our patients so that they understand and appreciate that they've called the right office. I've mentioned this to you earlier. I really believe in people work, not paperwork. I believe in outsourcing. If I can outsource insurance, absolutely. There's so many great companies out there. I would much rather have my insurance coordinator getting on the telephone and talking to people about their outstanding treatment plans and getting them into the practice and making sure that my appointment book is full. 80% of the decision to choose your care is based on your ability to connect with your patient. That doesn't happen necessarily when you're on hold with Delta Dental trying to get a benefit plan. I can outsource that information. I can get help. I have resources that will expedite that information for me so I can focus back on my patient. The patient's looking for the dental team to validate the doctor and the treatment. So I've got to have a quality employee experience. Got to involve the team in helping the patient understand and appreciate their dental care. And I've got to create a quality client experience, a quality patient experience. The patient is looking for every sign that indicates they're going to receive quality for their investment. 50% of our patients are visual learners. They have to see it to understand it. 25% of our patients are audio learners. They have to hear it to understand it. The other 25% of our patients are what we call visceral learners. They feel it. They have to feel it. When they walk into your office, what do they feel? What do they smell? What do they see? What's their gut reaction when they walk in? Those are all of those elements that helps patients, that helps people validate they're in a safe place, they're in the right place. Have you ever said, what is your gut reaction? I mean, that's sort of interesting. Well, what's the gut reaction that your patients have when they walk into your practice? They're looking for signs that they made the right decision. The relationship with the team is so important. It will validate or invalidate. They made the right decision. In fact, the relationship with the team can either encourage or discourage treatment. Most patients will say, actually 68% of patients leave a practice because they feel they were not cared for or listened to. It had nothing to do with fees. It had nothing to do with insurance involvement. It didn't have anything to do with the dentist. They felt an attitude of indifference, or they felt that they were being treated apathetically. So that's important. 70% leave your practice not because of your fees, but because of an attitude of indifference provided by the provider service. We don't mean to be apathetic. We don't mean to be, obviously none of you are apathetic. You wouldn't be listening to this. But sometimes familiarity, try to say that 3 times fast. Familiarity sometimes can breed apathy. Example, oh, I know Deborah. She doesn't need anything. This is going to be an easy cleaning. Yeah, she needs 2 crowns, but she's not interested. She has a low dental IQ. By the way, I've never seen a dental IQ test. She has a low dental IQ. She's not interested. She doesn't care. Her insurance isn't going to pay for it. I'm just going to clean her teeth. Wow. I know that sounds like you're doing what you think you're serving the patient well, but that can also come off as being apathetic or a bit indifferent about me, or a bit, I hate to use the word, but maybe even a little bit lazy about how we could really get that patient to be re-inspired and re-enthused about the quality of care that we could provide. So, put your attitude in check and ask yourself, would I want to work with myself? I come in and say, what am I looking for potential? What can I get? How can I utilize this appointment to help the patient feel how much we care? I think that's important, and sometimes that happens in recare and recall. We'll talk about that. How do you inspire the patient so that they know you're the office? That's the question you have to ask yourself. How do I inspire the patient so they know our office? How do you describe the quality of care that you provide? We've talked about that. Those would be great conversations for one of your team meetings. To ask yourselves, how do you describe it? What do they know about it? What visual aids do you incorporate? Once again, Revenue Well has great opportunities for you to make videos of the type of care that you provide. That you can actually specify what kind of video you'd like to send to a patient based on their treatment plan. Oh my gosh, that is like the coolest thing that Revenue Well offers that nobody else does. So the decision to accept treatment is being made the minute the patient calls your office. So be glad they called. Let them hear it in your voice. We already said that. Always present the ideal treatment first. So many times we talk about what insurance will and will not pay, or we talk about what we think the patient will or can't afford. And I'm going to suggest this to you, ladies and gentlemen. Your patients will never choose your ideal comprehensive treatment plan unless you present it. They always can say no, but if they don't know what they're not choosing, what would happen if years down the road they go to another office who presents them a more comprehensive treatment plan? You had it, you just didn't present it. They presented the treatment plan, and the patient says, "Wow, I wonder why my dentist never told me about that." Always present the ideal treatment plan first. You can always back down from what that might be. That's phased treatment, treatment alternative. But a couple of things to think about. People always say, well, I'm afraid if I present the ideal treatment plan to the patient, it might overwhelm them. I'm going to suggest that sometimes in our efforts to not overwhelm the patient, we underwhelm the patient. Example would be, when we might say something like this: well, before we do anything, we're really going to have to get you healthy, which is true. So we need to start with a soft tissue management program. We're going to do 4 quadrants of root planing and scaling. Then we will go in and talk about your treatment plan. Well, maybe when you talk about the end result first, here's what's possible. Here's what we could actually do for you. Might inspire me to be more interested in root planing and scaling, because I know that there is an end result, that there is a better place you're going to be taking me to. That's going to be important. I'm also going to caution you not to offer too many options for a patient. Offer your ideal treatment first, and then be quiet. Be quiet. Give the patient an opportunity to absorb it. If you give me too many alternatives, so if you present the ideal treatment plan and say, or we could do this, 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 or we could do nothing at all, or we could do this, now confusion sets in. And what experts will tell you is that a confused mind always says no. Think about that. A confused mind always says no. If you give me too many options without pausing in between, I'm going to be confused and I will do nothing. I will do nothing because I'm too confused. I can't think. How much also, I mentioned recare. I know that there are some experts out there and who say, always go for the new patient, always go for the new patient. Well, that depends on each practice. I mean, how many patients of record do you have? That would be a whole other webinar. I mean, what is your patient base? How many patients are coming in for recare? Wow, what kind of existing treatment is being left on the table, if you will, or in the records that isn't being done in your practice? So it's one thing to get a lot of patients in for hygiene, for cleanings and exams and checks. What additional treatment is being accepted out of the hygiene department? For me, that is absolutely critical number to monitor. What additional treatment is being diagnosed and accepted out of the hygiene department? So I think one of the most important questions you ask a hygiene patient before you start anything, before you do radiographs, once have you agreed, you have determined that their health history and everything is updated, before you jump into the patient's face, if you will, you sit back, you review if there's any outstanding treatment. Here's the question to ask. And it happens at the beginning of the appointment. Debra, I notice that there is some treatment that we have yet to be completed. I know the doctor will review that with you today. Tell me what has prevented you from having that done. That should happen at the beginning of the appointment. And then your body language is comfortable and casual, but you're looking the patient in the eye, you're looking the patient right in their face, eye to eye, you're sitting slightly back, and you ask that important question, and then you stop and you pause, and you give them an opportunity to respond, as opposed to say, well, you know, Debra, we've talked about those crowns before, you know, it's probably going to bring it up again. So let me get started. I have 40 minutes. Sit down, shut up. I hope you don't have any questions because I've got to turn this room around. So remember that the recare patient is critical. The more you contact, the more you connect with the patient, the greater their comfort. So increase your patient comfort by increasing your connection with the patient, having conversations. Oftentimes the question is, Debra, how much time should a hygienist spend with a standard average hygiene recare patient? Now, I can't even imagine that you doing it any less than an hour and 10 minutes. Most offices, I would say hour and 15, and some offices hour and a half. An hour is just barely making it. But these, 40 to 45 minutes, 50 minutes, that means that is here we go, strap in, because I've got a lot to do in a short period of time and I have no time to talk. And by the way, if I'm going to be talking to the patients, what am I talking about? Yeah, we're going to be social. We're going to talk about kids and dogs, and we're going to be talking about the last movie we saw and maybe a great recipe for brownies. But then there also comes a time we have to circle the wagon back to say, Mrs. Smith, you've been a patient for 15 years, and in 15 years we've become great friends. I love this social time we have together. Let's talk about where you are dentally. You're here. Let's talk about where you are now, where you were when you started 15 years ago, where you are now, and where we're going in your dental future. Let's talk about let's bring that back into not only making that a social hour, but also a dental hour. A quick story, because I know we're running out of time, and I'll open some time for questions and answers. So one of my friends called me one day and complained because he was charged for a recall examination in his office. And he says, "Oh, Debra, could you help me? I don't know. I need to call my doctor. I'm concerned because I got charged for a recall exam." And I said, "Well, John," I said, "did the doctor come in and see you?" He says, "Yeah." And I said, "Well, did he have some instruments in his hand and did he go into your mouth?" He said, "Yeah." And he said, "But he never talked to me about dentistry. He talked to me about my life. He talked to me about my work. He asked me about my kids and my family. We talked about, what was going on in the city, but he never talked to me about my dentistry." So sometimes we think that we're doing a nice thing because we're being very social, but there comes a time that we have to go back and talk to the patient about their care and about dentistry. So you might want to kind of assess that in your practice. And if you want to increase your treatment acceptance and your additional treatment out of hygiene, that might be a place for you to start and say, you know what? Let's really talk about, and maybe you're not even measuring it at this point. That's an important number to measure. So make the conversation matter. Make the conversation at some point circle back to dentistry and about why they're there. Where were they? Where are they now? Where are we going in their dental future? Make that conversation matter. Present your treatment plans with confidence. Present your financial protocols with confidence. And your standards in your practice are there for a reason. So be confident about them. Learn to negotiate with your patients. Avoid presenting the paper, the treatment plan. You have the treatment plan in writing, but if you present it to the patient, you're going to lose eye contact. You're going to lose their interest. They're going to go right to the paper. They're going to go right to the bottom line. So keep the paper, keep it back until you've had an opportunity to have a conversation and to negotiate with the patient. Present the paper toward the end of your conversation. learn to ask the right questions with patients. So oftentimes the patients, their first concern or the first obstacle that they will bring up is money. So ask this question: if we can solve the cost issue, what other concerns or obstacles should we discuss? Don't leave it at that when the patient says, yeah, I can't afford it, or yeah, let's see what my insurance will pay. Let's talk about, if we can solve that issue, what other concerns do we need to get out of the way? What other obstacles do we need to get out of the way for you to have this done? So don't stop at the first obstacle. There are other questions to ask, and where you can delve into finding out exactly why the patient is resistant to your care. I think that's important. I've talked about this earlier. Be careful about your familiarity with the patient. Here are the two questions that I previously discussed. What has prevented you from completing your treatment? Let me show you some examples of what we've done for our patients. Get your patients excited about what it is you have to offer. And that's a critical piece. Why is recare important to me? Because I think retaining more of your existing patients, retaining more of your customers can boost your profitability. It also reduces your need to go to spend more money on marketing to new patients. And what is the point of bringing in new patients if you're not retaining them? The whole idea about growing your practice is not only to attract patients to your office, but to retain them. So we do have to work on attracting, and we have to work on retaining. I think, once again, that's why Revenue Well does so well, because they help you retain the connection with the patient. Here's some quick things to think about as you are talking about customer service and the team side of customer care. First of all, patients don't talk to the practice, they talk to you. So have a great attitude. There's only one great judge of great service. We can complain and argue all we want, but the patient is the one who's going to really judge their great service. Patients don't think of themselves as patients, they think of themselves as people, and we should be thinking of them as people as well. They're clients, they're guests. So think about them. We're going to have better customer service when we think of them as clients and we think of them as guests in our practice. There's really no right way to talk to patients. Every problem's different, so every conversation is different. The more I know about the kind of dentistry that is being offered in the practice, the more adept I will be to be able to talk to the patients. Talk to the team, not just to the patients. I love it when I have an opportunity to collaborate with my team members on how we can be more effective in communicating with our patient. Great service is a bond. That's important. Again, don't create problems. Eliminate the obstacles to your patients. Acting on small complaints can generate big improvements. Your patient has a complaint, figure out how you can make that right. Learn to anticipate their needs, and know how to make good judgment calls. The more adept you are at making good judgment calls, the more you can work autonomously, and I think that's important. And if you really want to help your patients, don't be afraid to ask for help yourself. I think these are the two most important questions for you to ask in your practice. You can run all of your systems with these two questions. You can filter your effectiveness in your practice with these two simple questions. It can run every system in your practice. Number one, is this system good for the patient? Are our financial arrangements good for the patient? Okay, let's say allowing your patients to make small payments over a long period of time. Is that good for the patient? Well, you might say, well, yeah, it's great for the patient. Well, let's go to question number two. Is it good for the practice? Well, no, it isn't. If you have to answer no to either one of these questions, is it good for the patient? Yes. Is it good for the practice? No. Then it's not the right thing to do. You've got to be able to answer yes to both questions. Good for the patient and good for the practice. This system will work. So that, for me, anytime you're getting ready to embark on a new protocol or a new system, a new technique, a new team member, ask yourself those two questions. You're probably doing the right thing. I ask myself as a consultant when I go into offices, these are the two questions I always ask as I'm observing, as I'm looking at their systems, as I'm evaluating them. I'm always asking those two questions. You can ask those two questions for your practice and be your own consultant. Now, gosh, we've spent an hour together, almost an hour. I want to remember, the best training program in the world is absolutely worthless without the will to execute it properly, consistently, and with intensity. Education without action is entertainment. So the question will be for you today is, what are you going to do with the information that you've gathered? How is it going to make a difference in your practice? And the greater the difference that you make, the greater the reward. I believe that bonuses, I believe that raises, I believe that compensation is based on an increased profitability in the practice. And what was your personal contribution to the growth of the practice? And I think that's a critical piece. Remember that something small can make a tremendous difference. When we talk about customer service, something so seemingly small, Olympic races are won by 1/10 of a second. Golf championships are won by one putt. They're something so small. The small things you do for your patients can make a huge difference. So the question I have, of course, is how are you going to go out and make a difference in the patients' lives, the people that you touch? What small thing are you going to do today or tomorrow or in the next few days, the next month, the next year, to make a difference in the lives of your patients, to make a difference in your practice? For all of you who spent time listening to me for this hour, it went by so fast for me. And I'm happy to, to field any questions we have in the time that we have left. Thank you so much. A lot of information in a short period of time. So what questions can I answer for you? Jonathan, I don't know if any have come your way. I'd be happy to answer them.
We do have a few.
Okay.
So one practice who's attending, they actually had recently discussed the handoff between hygienist assistants and the doctor. Do you have any tips for when dealing with a handoff like that?
Well, I think this has been a conversation that I've had recently with one of my clients, the handoff. If I'm going to be utilizing a hygiene assistant, then the hygiene assistant should be at the beginning of the appointment. And then the hygiene assistant, whoever's going to be with the doctor during the examination should also be the last person, the last auxiliary that the patient sees. So if we're working with a hygiene assistant, and I have an article about that, then they are the first person and then they're also the last person. If that's the way the office is structured. If the hygienist is coming in and doing specific hygiene duties and then passing off the polish or passing off the end of the appointment to the hygiene assistant, then once again the hygienist should sanction the hygiene assistant. If the hygienist is discovering certain things that the doctor should be paying attention to during the exam, I really discourage writing it down on a tray cover, writing it down on a piece of paper, and then walking out of the room and having the doctor come in with an assistant alone. Who's ever discovered some of those treatment needs, I really love that they are in the room at the same time with the doctor for the examination, because they're the ones who probably validated that during the whole appointment. For me, it's an interesting choreography. So if I'm going to be handing off the examination, if I'm the hygienist handing off the examination to the hygiene assistant or to an assistant and the doctor, then I need to bring the hygiene assistant in early. And in front of the patient, I might say something like this: Susan, this is what Martha and I have been talking about while she's been in my care. Would you make sure that you and the doctor review these concerns or these evidences that I have found? And it's nice for the patient to hear it again from the hygienist as he or she is leaving, and then the assistant can take over and say, oh my gosh, what questions can I answer for you about that? So I think that's a nice way of handing that off.
We have a request to repeat the quote that you used for determining fees.
That's a favorite. That's one of my calling cards. That's a fave. Even at our Nash Institute, doctors always say, what was that again? What was that again? Our fees are based on 3 things. Number 1, the skill required to do it right. Number 2, the time it takes to do it well. And number 3, the materials that we use so that your treatment will last.
Excellent. We've got 2 more questions. I know we're up against it here, but I think they're good ones. When it comes to recare, should team members get commission? What is your thought on that?
I'm not a big fan of commissioned hygiene. I'll explain why. Hygienist does not work alone. A hygienist, unless I'm talking to offices that have independent hygiene or states that have independent hygiene. I think that we are all for one and one for all. Who collects the hygiene fee? Who keeps the hygiene schedule full? Who makes sure that we've ordered the proper hygiene materials in armamentarium? Who makes who appoints the patient? It takes everybody. So I believe that I love obviously the hygienist probably gets paid. Her pay is differentiated based on her or his credentials and licensing. So pay differentiates the responsibilities and the duties and the licensure of a hygienist. But when it comes down to bonuses, when it comes down to commissions, then I think it becomes, and commissions we could call bonuses. I think that is a team, it's a team effort to make the hygiene department effective. Again, hygienist doesn't work solo. He or she depends on auxiliary, so I think everyone should benefit. Sometimes the question to me comes up, some of my clients will say, should my hygienist get paid a percentage or a commission if she or he sells a treatment plan, presents a treatment plan that the patient accepts? Some people don't like the word sells. I think that's part of the job. I think that's part of the responsibility of every team member. It's not something that you're doing with extra effort. It should be part of your everyday responsibility in the practice to help the patients understand and appreciate the treatments you have to offer. I mean, our fees are based on two things. Our compensation is based on two things. One of them is net productivity. Did the practice increase its net production? Its net productivity. And I said productivity, that would be net. After insurance write-offs, after expenses, did we have an increase in our net profit, our net productivity? My increase in compensation will be based on that. And then the second criteria for additional compensation is, what was my personal contribution to the growth of the practice? So I think raises and compensation are based on those factors. But commissions, I call those bonuses, and they should be team bonuses. So everybody understands when we all work well together, everybody wins.
A question we just had come in. Do you have any suggestions or tips or advice on how to bring in quote unquote new patients without marketing and turning down HMO patients?
Wow, I hope I understand this question. Turning down HMO patients, that would mean how to bring new patients in without marketing? Wow. Depends on what type of marketing that you're talking about, what kind of new patients that you're looking for. I mean, certainly, even when you are asking your patients to refer their friends, that's marketing. So I don't think there's a practice that doesn't market. Now, do I need to do direct mail marketing? Probably not, maybe. I think that if I'm going to determine what kind of marketing plan I have, is it going to be heavily internally focused or is it going to be heavily externally focused, is based on a couple of factors. So I always suggest to an office, to a doctor, before you embark on any sort of marketing plan, before you buy any sort of plan that someone wants to sell, somebody calls you on the phone and says, "Hey, we want you to put you on the bags of the pharmacy bags in our departments in our grocery store. We want to put you on the back of the grocery store cart buggy." I want to know, first of all, is that the market I'm looking for? Are those the kind of patients I want to attract? Before I do any of that, I'm going to do a demographic psychographic survey of the community. I'm going to find out what the marketing trends are. What are the radio listening trends? What are the buying trends of that community? That will help me direct my marketing efforts. I think social media is critical in marketing. I can't imagine not growing your practice. I can't imagine growing your practice without some form of social media.
I agree
Oh, wait,
completely.
I'm sorry. Let me go back to the question about HMO. I think the practice has to determine whether or not they want to be an HMO practice or not. There are so many rules and regulations now and so many quirky protocols in insurance. For example, if you have multiple doctors in one office, if one doctor accepts a particular plan, that means legally all doctors have to accept that plan. You can't segregate. Like if you have a new doctor coming in and say, well, we're going to let him or her accept this plan, but none of the other doctors are, legally you can't do that. So you have to make a decision. Are we going to be uh, a fee for service practice? Are we going to have some insurance companies that we accept and some that we don't? That has to be, again, that goes back to doctor philosophy and doctor's leadership skills and how he or she wants to direct the practice.
All right, and we have one more, if you have time for one more, Deborah.
I'm here. I'm here.
All right, let's do it. Um, what's the best way to propose a treatment plan to a patient?
Ooh, great question. Whoever that person is, if I were standing in a seminar, they'd be getting a Starbucks card right about now. That is a great question for a couple things. Best way to present a treatment plan. First of all, ask permission. Avoid handing the patient a piece of paper. And again, body language, I don't have a desk between us. Who should present the treatment plan? Oh, we got to go back to basics. Who should present the treatment plan? The doctor should present the treatment plan. Let me say that again. It should be the doctor who presents the treatment plan. Now, will he or she eventually turn that over to a treatment coordinator or to an office manager, receptionist, whatever title you want to give this person, dental assistant? Yes. But when it comes actually down to presenting the treatment plan to the patient, it should come from the doctor. The doctor is sitting with the patient, probably side by side, whether it be in a consult room or whether that be in an operatory. And the doctor looks at the patient and says, would you allow me to tell you what I could do for you if you gave me carte blanche? Or would you allow me to tell you what I could do for you if you were my sister or you were my brother? Get permission to give the patient the treatment plan. What's the patient will say? No, don't tell me what you would do for your brother. Just tell me what my insurance will pay. So I would always, get permission. It should always come from the doctor. It should always be the doctor who presents it first. And someone should be in the room with the doctor when it's presented. And the doctor should ask permission from the patient if they may present the treatment plan to them.
We have a practice here whose doctor likes to call and confirm all new patient adults and welcome them to the practice. What are your thoughts on this, and how does that change the initial introduction to the doctor during an appointment?
I think that's pretty cool. Now you can do that. I mean, you can call. I'm going to wager that one of the reasons they're doing that is to ensure that the patient is going to be there, because it's pretty hard once you've spoken to the doctor and the doctor calling, say, and introducing himself or herself. It's pretty hard to not show up unless there's a big emergency or something significant that comes up. So when the doctor's calling, I'm sure he's calling and saying, I'm looking forward to meeting you tomorrow. I've never called to confirm an appointment, by the way. I'm calling to verify their time. So I might say, this is Dr. Buckley. I wanted to introduce myself. Thank you so much for choosing my practice. I will strive to merit your confidence. What questions can I answer for you about tomorrow's appointment? I think it's a great idea. I think it's connecting. Patients are going to say, oh my gosh, do you know that my dentist actually called me before my appointment to introduce himself or introduce herself? I mean, it goes back to also, one more thing. So I think that's really cool. I also think it's really nice when we call patients after a procedure, certain procedures. By the way, I know that also you can also send a video. I also think one other piece is to call a new patient after their initial visit. This would be for new patients who did not reappoint. For some reason, they had find out what my insurance will pay. I had to check my schedule. Let me talk to my spouse. Let me think about it. For whatever reason, they didn't schedule the next appointment. Then I will ask permission to follow up with a phone call. And so, because think about this, new patients oftentimes leave with a lot of information, and they're sitting in their car driving away thinking, oh my gosh, I forgot to ask this critical question. And sometimes we say, well, if you have any other questions, give us a call. Well, do they call? Sometimes, sometimes not. They might feel like their question is stupid, or life gets in the way and they forget to call. So how great for me to call, or for a doctor to call, depending on the size of the practice, the significance of the treatment. When I say, Jonathan, this is Deborah from Dr. Nash's office. Dr. Nash asked me to call. We know we covered a lot of information when you were in the office the other day, didn't we? Yes. Yeah. He's asked me to make myself available to answer any questions you may have had after you left our office, or as you were sharing your experience with your friends or your family. Some questions had come up. So what questions can I answer for you? I have found that for my clients who do this, for every 2 phone calls like that they make, one patient who didn't appoint makes the appointment. They needed one more touch.
Okay, and this appears to be our last one, unless
Okay.
another one comes in while you're answering. With so much focus on personal interaction and face-to-face and really, interpersonal skills, how many people do you recommend man the front desk?
Woo. You and I talked about that earlier. Well, think about this. You've got to tell yourself, it depends on the size of the practice. But it takes, if you multiply how many patients you have in a day times 10, it takes 10 minutes per patient for front desk interaction. So, I mean, if you sit down and say, well, let's see, we've got 2 hygienists that are working. We have 2 hygienists working. They're seeing 16 patients. So 8 patients a day, so times 10, that's 160 minutes. And the doctor, I have 1 doctor who sees 8 patients a day, so that's 80 minutes. So I've got 240 minutes divided by 60, that's a half a day, that's 4 hours of time saying hello, goodbye, collecting money. That's half a day. So if I have a practice that size, I might necessarily need 2 people. Now, also, what are those people doing at the front desk? Again, I would much rather have 2 people at the front desk, a hello person, a goodbye person, than an insurance coordinator. I would move an insurance coordinator into a front desk, a patient interaction, a patient ambassador position, and outsource my insurance if I can. But just, I think every office needs to do the multiplication, do the math, and say, based on the number of patients we see in a day, times 10, here's how much time I'm spending in patient interaction. Do I need another person? Because I'm spending 6 to 7 hours saying hello and goodbye. I'm not getting my other stuff done.
Awesome. Well, thank you so much, Deborah. Thank you, thank you, thank you. This was fantastic and really informative. And to all our attendees, thank you as well. We will be sending out a recording of this webinar after the fact. So, if you came in late or you jumped in and out, there'll be a recording. So fear not. And that's all we have. So thank you so much. Appreciate it.
Thanks for listening, everyone.